The University of Johannesburg and the Human Science Research Council conducted an online survey to establish the general feeling among South Africans about the COVID-19 vaccine. The results yielded from the survey showed that 67% of the adult participants would accept and take the vaccine when it becomes available. The researchers who conducted the survey say people who are doubtful have legitimate concerns around the development and the rollout time of the vaccine. Well, Professor Carin Runciman, the director of the Center for Social Change at the University of Johannesburg, talks to us now about that survey. Good to have you, Prof. Thanks for joining us.
Thanks so much for having me.
It's an absolute pleasure. So let's talk about the dynamics and the kind of people that participated in this survey: race, age, levels of employment, etc. Talk to us about that.
So this has been an online survey, and in this round we had over 10,000 participants from across the country. And then what we've done with the data is we've weighted it so that we can say that it's broadly nationally representative. And so I think that's what's so encouraging about these findings, is that broadly we can say that this represents the general view of adults in South Africa.
Yeah, so your survey, basically, as we said in the introduction, finding that 15% of participants were not sure about how they feel about this vaccine. And it's understandable, it really is. I mean, if you think about it, it's less than a year since we all started panicking about this COVID, this thing we'd never heard of before, COVID-19. And now there's this prospect of us getting a vaccine. We'll talk about that in a short while, maybe this year, maybe next year, who knows anymore. But I mean, talk to us about why it is that certain people are nervous to get this vaccine.
So when we analysed the reasons that people were giving for their hesitancy around taking the vaccine, particularly amongst those who don't know if they will take the vaccine, there was a real demand for more information. So people wanting to know, how do I know a vaccine is safe? Even asking questions, what is a vaccine? And as I say, I think these questions are really legitimate questions. They're questions that people want answers to so that they can make informed choices about their health. And similarly, amongst those who were saying that they don't want to take the vaccine, there were big concerns about side effects and about uncertainty around the testing of the vaccine. How can we definitely know this vaccine is safe? And I think what this illustrates is if we have good public health information that addresses these concerns, there is an opportunity to perhaps change the minds of those who are currently vaccine hesitant.
Yeah, this is something that is very understandable. It's the unknown. There's been such nervousness around coronavirus, catching it, and now there's so many unanswered questions because of the unpredictability of this virus itself. And then comes this vaccine, and we're still studying the efficacy of this vaccine. Obviously, we're running in our news now that there have been findings that some of them, the Moderna and the Pfizer vaccines, seem to be quite effective against this new strain in South Africa. However, the one that we're waiting for, the AstraZeneca one, is the one that we are supposedly going to be getting. So again, there's so much up in the air that is making a lot of people nervous. And we can, I suppose, talk to that quite a bit. I mean, you yourself, being a professor in this industry, I mean, do you feel comfortable with it?
Personally, I feel comfortable with it. But as I say, I think having more information about the different vaccines would definitely be very, very useful. There is, information coming out all the time, as you're indicating, about, will it be effective against new strains? And I think, in this time, obviously, where we can get so much information very easily, but sometimes it is difficult to differentiate between, what is reliable information, that if we had government really lead a public health campaign that answers some of these questions, but not just government. I think we need involvement of civil society, of our religious leaders, and, all kind of stakeholders in society to help publicise information that will address concerns of people who are currently vaccine hesitant.
Yeah, I mean, I even see that the president actually said in his weekly letter on Monday, government will launch a communication campaign to actually address doubts and fake news about the COVID-19 vaccine. So that's good news. But this also coming on the back of what your survey revealed. Perhaps talk to us about this. 73% of participants actually felt like the president was doing a good job at handling the pandemic. That's quite interesting. I mean, let's put those aside and let's perhaps look at the ones that didn't think he's doing a good job. Why? What are the reasons they think that he wasn't really doing his job well enough?
So what's really interesting about the work that we've been doing is that we've been conducting surveys basically right from almost the beginning of the pandemic. So our first survey took place in April 2020, and we've repeated it in 3 rounds. So that has given us a kind of temperature of how people think the president and the national government have been handling the COVID-19 pandemic. So what we saw back in April 2020, we saw quite high levels of confidence in the president's handling of the pandemic. But this began to dip when we did our second round in August. But confidence seems to have come back up again slightly with this latest round. But what it also demonstrates is that people's trust in our political leadership plays a very powerful influence on their likelihood of vaccine acceptance. So amongst those who were saying that they think President Ramaphosa is doing a good job, 73% said that they would take the vaccine. But this was much, much lower for those who thought he was doing a bad job. So it does really illustrate that what our political leadership, as well as providing health information, political leadership does play a powerful influence on the likelihood of people taking the vaccine.
Yeah, and that is important. And I mean, that was hence the discussion we just had with our police minister, talking to leadership, talking to the fact that they setting an example in what they do. And, South Africans are watching. They are looking to their leaders for this kind of example of wearing masks, washing, and then when it comes to washing hands, when it comes to getting a vaccine, that's also quite important to see who's first in line to take this. And I know we ran a poll about, do you think politicians should be the first to get it or not? Some were saying yes, but not in the way that we think, perhaps, because they just want to see, is it safe? Do they survive? Let's test them first. But that's that's the way things go. I just want to very quickly ask you, as a final wrapping up question. There's also concern that not enough communication has been done. We spoke to this a little bit, but it may be a little bit too scientific for people to understand, and B, language is a problem. Well and good if you can speak English and you can tune in and read all the articles that are doing the rounds, but for any other person who doesn't and is not fluent in English, this is where there's a big gap. Do you think there is enough in our other languages to assist the public?
I think this is absolutely crucial, that we need to be communicating in all of our languages. But I think this also highlights the importance of, obviously, government must take the lead in this messaging and making sure that it's multilingual, going into community radio stations, providing material that those radio stations can play, particularly in rural areas that may not be served well by other forms of media. But also, as I was saying, this also highlights the importance of civil society, of religious leaders. There's a variety of different stakeholders that can play a role in helping to spread factual information about the vaccine. And I think if government can take the lead in helping to provide some of that material, so that other people can become involved and spread messages about what we do factually know about the vaccine.
All right, we'll leave it there. Prof, thanks so much for talking to us. Professor Carin Runciman, who is from the University of Johannesburg, talking to us about the survey conducted by UJ and the Human Science Research Council about the level of acceptance of the COVID-19 vaccine among South Africans. Right, quick look at your sports news. Here's Valen.